What are the rules for impetigo and school attendance? Have you ever wondered what happens when a child has impetigo and how it affects their school attendance? Impetigo is a common bacterial skin infection that often affects children. It shows up as blister-like sores, usually around the mouth and nose. This infection spreads easily through direct contact with the fluid from these sores. So, what does this mean for school? When a child has impetigo, they should generally stay home from school while their sores are draining and contagious. This is important to prevent spreading the infection to other kids. According to medical guidelines, children can return to school at least 12 hours after starting antibiotic treatment. However, there are a few conditions that must be met. First, the sores must be covered to help stop the infection from spreading. Second, the lesions should be dry and crusted with no drainage. If the child still has lesions but has a note from a licensed healthcare provider, they may be allowed to attend school. Good hygiene practices are crucial in these situations. Frequent hand washing is essential, and children should cover their sores. It is also important to avoid scratching or touching the sores. Sharing personal items like towels or utensils should be avoided. Activities like contact sports should be put on hold if the sores are still draining. Sometimes, schools may ask for a note from a healthcare provider confirming that the child is no longer contagious and is fit to return. This helps ensure the safety of both the child and their classmates. In summary, the rules for impetigo and school attendance focus on keeping children home during the contagious phase when sores are draining. Once they start antibiotic treatment, cover their lesions, and follow hygiene practices, they can typically return to school after 12 hours. These guidelines help minimize the risk of spreading the infection and keep everyone safe. Always remember to consult a healthcare professional for personalized advice regarding impetigo and school attendance.